Good afternoon, everyone. Thanks for joining us again for the Interagency Joint Press Conference following the Norfolk Southern train derailment here in East Palestine. My name is Craig Browning. I am an External Affairs Officer assigned to this event. The participants that will be speaking are U.S. Environmental Protection Agency Region 5 Administrator Deborah Shore, FEMA Region 5 Regional Administrator Thomas Sivak, and CDC ATSDR Team Lead Jill Shugart. Also on hand for questions is Ohio Department of Public Safety Director Andy Wilson, Ohio Department of Health Deputy Director Lance Himes, and Federal Railroad Administration Public Information Officer Corey Gaddy. I will ask that you keep our ASL interpreter in your camera shot. We will open the floor to questions after our speakers present. Thank you.
Good afternoon. As Craig mentioned, I'm Deborah Shore, the Regional Administrator for Region 5 of the United States Environmental Protection Agency. Thanks for joining us today. Earlier today, EPA Administrator Regan was here in East Palestine to announce the grand opening of our new Community Welcome Center at 25 North Market Street. This is a place where members of the community can meet with staff from EPA and other agencies to get their questions answered and to learn more about services available to the community. We will be open from 8 a.m. to 8 p.m. every day. If you were at the Welcome Center earlier today, you would have seen the latest high-tech piece of equipment that EPA has brought to East Palestine. It's the TAGA bus. And TAGA stands for a Trace Atmospheric Gas Analyzer Mobile Laboratory. Within hours after the derailment, EPA began conducting stationary and roaming air monitoring and sampling throughout the community. Now, as we transition to the longer-term remediation phase, EPA is deploying this TAGA mobile laboratory, which will conduct real-time air monitoring and sampling analyses during waste removal. This means we don't have to send samples away for analysis. We can analyze them right here in the bus as we collect them and provide the results in very quickly. In coming days, you'll be seeing more of the bus as it drives around town, checking air quality. But before then, we'll be setting up some opportunities for people to come and tour the bus, to talk to the scientists, and learn more about how this state-of-the-art equipment will help us ensure that the air is safe to breathe in East Palestine. We'll have more details to share tomorrow. And lastly, I'd like to introduce a new member of EPA's team here in East Palestine, Mark Durno. Mark is a modest guy, but I want to tell you he's one of EPA's best regional response coordinators, and he's a native son of nearby Warren. Mark has come to East Palestine to ensure strong communication and coordination with our local, state, federal, and community partners, and I'm grateful for him being here and lending his support. Thank you.
Thank you, Regional Administrator Shore. My name is Tom Sivak. I'm the Regional Administrator for FEMA Region 5, and I'll offer a few updates. As of today, we had 66 FEMA team members engaged in the interagency effort throughout the community, primarily focusing on supporting the interagency efforts and then also visiting residents and ensuring residents receive up-to-date information. As of this afternoon, interagency teams dropped 84 informational flyers in Ohio and 86 informational flyers in Pennsylvania. This brings the total number of interactions to 719 in the past few days that teams were in the community. FEMA staff are supporting the mission as well by assisting in distributing these flyers, answering questions, and engaging with the residents where they're at. Residents with any questions about air monitoring, soil sampling, water testing, or just general questions should contact the 866 number and the hotline that are on these flyers that everyone's receiving at their homes in impacted areas. That number is 866-361-0526. Again, that number is 866-361-0526. Tomorrow and in the coming days, we will continue to support this effort for as long as we are needed, especially with the interagency effort behind me. I want to remind all of us that we are committed to the safety and well-being of the people of East Palestine and Beaver County. These joint interagency press conferences will continue daily, and we will continue to support the effort for as long as we are needed. Thank you.
Good afternoon, everyone. My name is Captain Jill Schuckert, and I am currently serving as the CDC ATSDR East Palestine team lead. I also would like to share just a couple of updates about what our team is doing. Our team is meeting with local, state, and federal leaders of first responders to coordinate our ACE, that's our Assessment of Chemical Exposure Responder Surveys. We really want to make sure that we get critical feedback from those first responders before we get our survey launched later this week. We are also working with local, state, and federal partners as part of the new Community Engagement Task Force to ensure coordination of public health resources and proper distribution. An example of this is that we are planning to conduct door-to-door ACE surveys this week in East Palestine in coordination with our local, state, and federal partners. Thank you.
And with that, we'll open it up to questions.
I have a question for FEMA. We know that local families here were given $1,000 from Norfolk, and a lot of people we've spoken to said that money ran out within the first day or two. Is FEMA reconsidering giving any financial aid to families, even though it did not fall under the natural disaster category?
I can't speak to what the company is providing. I do encourage anyone that has any questions for what the company is providing to reach out to the Family Assistance Center, and all of that information is also on these.
I'm trying to get a little bit some more clear information on why the EPA is not looking for additional toxic chemicals like dioxins that could still be emitted from the site. I did ask Administrator Regan today about this, and still the answers just continue to be vague. And he says the EPA will do more to close the information gaps in the data, but how is the EPA going to educate the public on how you guys are doing this air quality testing and why dioxins are not being included?
Several parts to your question. I'll try to answer them all. We are posting air monitoring data publicly on our website, that which doesn't compromise personal information from testing inside homes, but we found no exceedances of volatile organic chemicals in the air testing we've done inside the more than 570 homes we've tested. I would invite you to tour the Tagabus and maybe ask them to go to certain areas if you feel that there are areas that deserve some additional testing, and that's true for any resident in the greater community. Visit with the bus and see what they can do.
Well, aside from the homes, from the site, are you guys looking for other chemicals, not from the train, additional chemicals that could have formed from the combustion and the controlled burn?
We have 15 stationary sites throughout the community that have been monitoring 24/7. Since the vent and burn event, they continue monitoring full time.
But what is it that they're looking for? Like, what other chemicals are they looking for that could be dangerous?
There's a whole suite of chemicals that they can test for. We did specifically, after the vent and burn, look for the primary byproducts of the burning of vinyl chloride, which are phosgene and hydrogen chloride. Dioxin is a secondary byproduct. We didn't find elevated levels of those primary byproducts, which suggested to our scientists that there was not a further risk of dioxin exposure. However, I've been with Administrator Regan today. We were with students at the high school in the morning, visited with some business owners. We've heard from many residents about their concerns about dioxins in the soil. We are exploring what kind of soil sampling might be prudent and available for this community. That will be folded into the work plan that's being developed for the overall community response and remediation from the derailment. I can't give you more specifics right now.
What's the method of the air quality testing? Can you explain more about how it's tested, like what instrument is used?
Yeah, this is where Mark can help me, is our great regional response coordinator, Mark Durno.
Yeah, Mark Durno, EPA. So with the trace atmospheric gas analyzing bus that Deborah referred to, the TAGA bus, it's primarily used to sample the air, not just monitor, but sample the air for volatile organic compounds. It could also do what we call analyze for tentatively identified compounds. Those are some of the compounds that you may be interested in seeing. If we see them in the air, recognizing that they shouldn't be, that there are compounds there that shouldn't be there, that may prompt further assessment or further work that would need to be done. So again, it's not just the volatile organic compounds we're doing, but we're also looking for tentatively identified compounds.
Deborah, I just want to get this right. You are going to find a way to test for dioxin somewhere down the road? Is that what you were alluding to?
I'm saying it's being looked at in the work plan. I haven't had eyes on it because it hasn't been submitted yet.
Thank you.
Additional questions?
I do have another question. Is it the photo ionization detectors that are being used for air monitoring? And what specific chemicals are volatilizing and aerosolizing?
So yes, a photo ionization detector is part of the suite of monitoring that we're doing. So when I was talking about the TAGA bus earlier, that was air sampling. That's real-time air sampling. The photo ionization detector is a monitoring tool. So that tells us what the entire suite of volatile organic chemicals are. It doesn't tell us specifically what we're looking for. Within those air sampling units, we also have chemical-specific sensors. They can pick up some of those compounds that are specific to these types of releases. So, in addition, so the photo ionization detector, or the PID, is one of the devices that we use to sample for, monitor the air quality.
There's been some outside experts that say that the PID, those detectors, are not adequate for testing. So are there other ways you guys are looking for testing?
Yes, so that's monitoring. So and the PID gives us a quick snapshot of volatile organics that might be coming off the site. That's what we're not seeing. But again, we do have chemical-specific sensors for sampling, for monitoring. And we also have what we call SUMA canisters that are actually collecting real-time real-time air quality samples. Those are submitted to the lab, and those are analyzed to determine whether or not we have chemicals at lower level that we might be concerned about. And again, we're not seeing anything above our screening levels at this point.
And these are being tested at the site?
At and around the site, yes.
I have a question about private well water. A lot of people are waiting on these tests to come back. Basically, what is taking so long? They were able to tell whether the municipal water was fine. I know those are deeper injection wells, not where the site, but everyone is worried about their private wells. How many have been tested? Why are the tests taking so long, and what are the findings?
The testing of private wells is done in the Columbiana County Health Department in collaboration with Norfolk Southern. They are taking what are called split samples at the same time from the well, and sending them to 2 different labs. I have not seen those results, and I don't know how long it takes to get them, but that's, again, private information provided to the well owner. It's not being made public.
Well, they're telling me that they aren't receiving the data, and they want to know what's taking so long. They want to know if their animals can drink the water, et cetera, whether it's safe. How long before that's expedited so they know?
I would suggest they direct their questions to the Columbiana County Health Department or to Norfolk Southern. They're the ones doing the tests and have the contracts with the labs.
Why would Norfolk Southern be doing the testing when they're the ones who caused this mess? Isn't that like having the fox guard the hen house or having the criminal process the crime scene?
This was an arrangement that occurred prior to US EPA's taking over the whole emergency response and remediation. In the early days, it's Ohio EPA that was doing that. Again, the purpose of split samples is to make sure that the tests are verified from different lab sources. So it's a highly regarded laboratory and sampling technique, but I can't speak to why Norfolk Southern was partnering with Columbiana County.
Okay, thank you, everybody. We'll have this press conference again tomorrow at 4 o'clock. Thank you.